Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Fusio Facet Fusion. Introduction. Low back and leg pain caused by degeneration in the back is a common condition that limits your ability to move, walk, and work. The degeneration in the back can affect the disc between the vertebrae. The degeneration can also involve specialized joints between the vertebrae called the facet joints. The degeneration of the discs and the facets can cause severe back pain and can cause some abnormal movement between the vertebrae. This abnormal motion between the vertebrae is known as instability. Healthcare providers may recommend surgery for people suffering from degenerative disc, facet disease, and instability. If your healthcare provider recommends surgical treatment for your condition, the decision whether or not to have surgery is yours. This program will help you understand better the benefits and risks of this surgery. Anatomy. The spine protects the spinal cord and nerves that go to different parts of the body. The spine is formed of solid vertebrae. The vertebrae are separated by softer discs. Two joints link each two vertebrae. These are the facet joints. They are located toward the back and on both sides of the vertebrae. These joints allow the vertebrae to move painlessly. Symptoms and their causes. The discs and facet joints of the spine may degenerate over time. This can cause pain in the back and legs. This MRI shows normal discs. This MRI shows degenerated discs.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Use of a lumbar corset may help with the symptoms. Physical therapy may also relieve the symptoms. Traction could also be used. Medications can be helpful in decreasing the swelling and inflammation. Some of this medication may be injected directly around the nerve in the spine. The medication can also be placed inside the facet joints. When all else fails, an operation may help. Surgical treatment. This operation is usually done under general anesthesia. The procedure usually takes 1 to 3 hours. The spine is approached from the back, usually through 2 very small incisions on either side of the spine. Rarely, the operation cannot be done through these small incisions. 1 or 2 big incisions may be needed if your surgeon decides that it is safer for you. Special instruments are placed in the facet joint under X-ray guidance. These instruments allow the placement of a piece of cadaveric bone inside the facet joint. Over time, the bone will grow from one vertebra in the joint to the other vertebra, causing the 2 vertebrae to move as one. This is known as fusion. This is done using a novel system called Fusio. The piece of bone is taken from cadavers and has been tested for known diseases. The incisions are then closed and you are allowed to wake up. Your healthcare provider will tell you how long you are likely to stay in the healthcare facility. This depends on several factors such as your age and medical condition. Depending on how well you do, you may go home the same day. Risks and complications. This operation is very safe, but there are several possible risks and complications. These are unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips or chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, pneumonia. Your anesthesiologist will discuss these risks with you and ask if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your healthcare providers know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed after surgery may help decrease the risk of blood clots in the legs. Some of the risks are seen in any type of surgery. These include infection, deep in the back or at the skin level, bleeding, skin scars that may be painful or ugly. Other risks and complications are related specifically to this surgery. These again are very rare, but it is important to know about them. In extreme rare cases, structures in or around the spine may be injured. This is very rare. These structures include the nerves, blood vessels, and bowels in front of the spine. This could lead to nerve damage and make more operations necessary. There is also the possibility that the operation may not help the symptoms or may even make them worse. The fusion may not take, and another operation may be needed to repeat the fusion. This is more likely to happen in patients who smoke. This is why it is very important to quit smoking at least 6 weeks before the time of the operation. After the surgery, no repetitive bending or twisting or heavy lifting is allowed in the few weeks following the operation. You may be asked to use a brace for a period of weeks to months. After this period of relative rest, physical therapy may be necessary to allow you to resume your previous activities. Whether or not you will be able to resume all previous activities depends on how well you are doing at the time of your follow-up. Your healthcare provider will tell you how long it will take before your back is healed and when you can go back to work. This depends on your age, type of work, and medical condition, as well as other factors.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Low back and leg pain caused by degeneration in the back is a common condition that limits your ability to move, walk, and work. Fusio Facet Fusion is an operation that fuses 2 vertebrae in the spine to help relieve the symptoms of disc and facet degeneration. Special instruments are placed in the facet joint under X-ray guidance. These instruments allow the placement of a piece of cadaveric bone inside the facet joint. Over time, the bone will grow from one vertebra in the joint to the other vertebra, causing the 2 vertebrae to move as one. This is known as fusion. This is done using a novel system called Fusio. The piece of bone is taken from cadavers and has been tested for known diseases. This operation is very safe with excellent results, but complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.